Welcome to the 55th annual FSHP conference here in Orlando, Florida. Today we're joined by Kathy Baldwin and Joseph Salzverg. Salzverg. And this is the first ever FSHP podcast here at the conference and in Orlando. So thank you so much for joining us.
Absolutely. Thanks for having me.
Thank you.
So just for our audience, can you just both of you introduce yourself and how your FSHP experience has been so far?
So I'm Kathy Baldwin, and I've been coming to FSHP for about 20 years. And as expected, the annual meeting is spectacular. We had a very professional House of Delegates yesterday, and the meeting so far, and I intend that will continue, is spectacular.
Thank you.
My name is Joseph Salzverg. I'm with the law firm of Gray Robinson. I'm an attorney and a lobbyist, and I've been honored to be FSHP's contract lobbyist and general counsel for about 3 years. Very much missed this conference last year, and there really is no substitute for in-person, and so far I'm having a blast, both intellectually stimulating and personally rewarding to see everybody, and happy to be here and happy to be here with you guys. Thank
you so much. That's awesome. So, pharmacy, fighting for the profession, something that you guys know are very good at and do a very good job at. It's not a one-man team. It's a big team that needs to go into that to try to move the profession forward. How important is it for you to have a well-rounded team in your corner that isn't afraid to challenge you?
I think it's super important to have people that are diverse with different ideas. I find that I listen more than I talk during the legal and regulatory meetings. I find that working with Joseph gives me different insights. It was a student last year who said to me, you really need to engage the health system teams and their legislators before we even go into the legislative session. And I thought to myself, that's the wisest thing I've ever heard. And we implemented it. And that was the key to passing our legislation last year. So listening to people and embracing them and their ideas really takes it to a whole new level.
Yeah, and dovetailing off of those comments, I think that this society does a very good job of listening to their association members, both pharmacists, pharm techs, and affiliates. And, it's their job to filter those ideas and those priorities up to me, and it's my job to splash some cold water on the faces of those somewise and say, this may be a very meritful cause, but it's not politically feasible at this time. And also, these all may be priorities, but we need to prioritize so that we can put our efforts where they need to be. I'm very pleased of what not only this society does internally, but externally in working with. We were able to really bring in the Florida Medical Association after years of contentious relationship because of how we acted and what we're doing right now in coalition building with other interest groups. So not only internally, but externally, FSHP allows me to do my job better and easier because of that coalition building that you're alluding to.
And if I could say one last thing, we are looking to collaborate with health systems and physicians and nurses, Medicare patients and non-Medicare patients, so patients in general, to work towards those goals that improve patient safety and care. So we are looking to collaborate actively.
And when you are looking to collaborate, I guess what are some of the selling points that you are giving everyone? Because, that is a tough sell, on a financial level and on a system level. So what are some of the key points there?
I think the key point is that pharmacists are not siloed. We are part of the solution to health system drug therapy issues. So we come with bringing forth drug therapy issues like 340B and white bagging and brown bagging, and we bring our perspective, but we're looking to work with them to get their perspective and take one legislative voice to Tallahassee.
Okay.
Yeah, and Kathy's completely correct. I think sort of what we bring to the table is we're not going to do anything half-assed, pardon my language, but also I think our efforts in the last 3 years have shown, both from me and my partners on the advocacy side and the membership and their grassroots involvement in being substantive experts, if FSHP is looking to collaborate with you, I think they know that we're going to come full force. We're going to come with our best foot forward. They have hired help to help navigate that process. And I really just think it's continuing to highlight FSHP as a hardworking, willing partner and not just somebody who's going to kind of go along for the ride and take credit.
What is your vision for 2021 and so forth? Like 2020 was kind of like a pause. What did you experience in 2020, and what is your vision for 2021 for pharmacy?
Go ahead, Kathy.
So the national bill that is provider status in the medically underserved, and I can get you those bill numbers, is paramount. And we are having a massive grassroots outreach August 15th and that entire week, where we want to reach out to our congressmen and Senators Rubio and Scott and bombard them with the message that pharmacists are key players in healthcare. And in order to be in a sustainable model, we need to be reimbursed for cognitive services in the same manner that dietitians, nurse practitioners, and PAs are. Although we don't function in their job function, we can remove some of that medication therapy management issue from the physician and allow him to see and diagnose more patients. So our message is we are indeed healthcare providers.
Why do you think it's been so hard to get that message across? Or has it been hard? And if the answer is yes, why do you think it's been hard?
And to piggyback off of that, what is the common pushback you are seeing when you are trying to advocate for these things?
It's a lack of understanding. Nurse practitioners and physician's assistants have a model that a pharmacist will never have a model similar to that, because we don't perform differential diagnoses and we don't prescribe. But what we do is we optimize medication therapy. And so we will never practice by ourselves. We, 2 years ago in the legislative session, thanks to Joseph, obtained collaborative practice. And in doing so, it sets the next step, the natural step, is provider status.
I have a question for you, Joseph. When you joined FSHP, what was your goal?
My goal was when I joined FSHP, this was a society on the rebound, and my goal was to provide them honest, substantive, hardworking advocacy, but also tough counsel on how they can rebound, especially in the eyes of the legislature. And my goal is to make sure that they felt listened to, and that and really just to give them a voice. I think pharmacists in a hospital, in a clinical, and an academic setting are not what comes to mind when we think of pharmacists. We think of a retail and a commercial setting. And my goal was to advocate their efforts and increase their visibility. And they've given me the tools and the partnership that I'm very happy with the success we've had, but we have a lot more to do.
And so we've talked about the goals, we talked about some of the pushback that you have faced. So now, what are the future goals? What is the 5-10-year plan? What are some things that you think need to happen in the next couple of years for the professional pharmacy and for FSHP in specific?
So as it relates to our efforts in Tallahassee, I think increased visibility, increased political engagement is always good. I think not only will that help us in our advocacy efforts, but I want our members to be the folks that elected officials call to as a resource on healthcare needs. Because if they view you as a resource, our advocacy is that much easier and that much more fruitful. We have a plethora of policy initiatives that we want to pursue. And I would say our list is going to take about 10 years because there's some big lifts there. And some of those are 340B protection, white bagging and brown bagging reform, farm tech certification, parity, provider status. And as Kathy knows, government is incremental, and you just have to build upon every year. And sometimes, you don't get your offensive objections because you have to go kill some really defensive stuff. But just building upon that, understanding there's a cadence to this, and understanding what I appreciate about my clients here is their long-term view and understanding that it's not just going to happen overnight. And when you have a client that understands that, you're able to really plan accordingly and attack accordingly.
When you joined FSHP, what is one thing you've learned about pharmacists and the pharmacy profession?
the passion. The passion, you know, but the only interaction I had with pharmacists was getting my medication and arguing over my premium and copay. The passion that these individuals have, not only in their practice, but for the patients, is just beautiful to see. You know, I come from the legal and lobbying side where, you know, if it makes dollars, it makes sense. I mean, it's a very corporate, financially driven industry, as many of ours are. And obviously these folks are all here to make a living, but they're, you know, when I argue, the best way I could describe it is when I argue and advocate for their positions, they're never suddenly me coming from a dollars and cents standpoint. It's always a patient safety and improving patient outcomes. And that ties to their passion. And their passion has been surprising and just and awesome to see.
And for you, Dr. Baldwin, what have you learned about the law side of things?
Well, I learned something very important that I shared this morning, and that is, well, besides government being incremental, that as a pharmacist, I am not educated on legislation and regulation. And Joseph is my expert. And when he says kibosh, then I need to stand back and say, interesting, kibosh. So it's been a very interesting relationship. So I think listening to people, bringing concerns forward, and then recognizing that as a pharmacist, I don't know anything about this. And I need to have a trustworthy partner who does. And I'm very blessed to say that I do.
And what do you think the impact of creating those non-traditional roles in pharmacy will be for the profession?
That's huge, because there are pharmacists and we are underutilized. And our goal, my mission, is to see a pharmacist in every physician clinic office so that the pharmacist can manage the 10 and 12 chronic medication therapy regimens, allowing the doctor to be freed up so that he can see and diagnose and prescribe to more patients. That's my vision for the profession.
And from a legislative standpoint, thinking outside of the box and adjusting based on, you know, society and market trends goes back to the legislature viewing us as a willing partner. You know, certain healthcare practitioner organizations have been, you know, flicked or beaten down over the years because their view as protectionism of their practice and their revenue streams to the detriment or without consideration of the patient outcomes and patient population. And I think that we are the other side of that coin. And that's where I feel that this association and constantly exploring, you know, the role of pharmacy techs or collaborative practice agreements, it shows that we are willing to juck and jive and be flexible, which is very well received from legislators who are trying to increase patient outcomes and decrease costs by law, not by operation of health systems.
What do you think has been the toughest career decision you each have had to make?
You go first.
So for me, when I graduated with my BS in pharmacy in 1985, around the 1990s, I realized that my degree was a dinosaur and I needed to go back and get my doctorate. So thanks to Sven Norman, who came through my neighborhood from UF Working PharmD program, I was able to spend 3 years and get that doctorate degree. And then I realized, and I had a mentor, which is very important, who told me, okay, Kathy, congratulations, you're just like the rest of us now. Go get a residency. So I stopped my job, I got a residency, and that has been opened doors for me that otherwise never would have opened. So I think recognizing that I needed to make some serious life changes in my education. And then I went on to get a master's degree and board certified. So it just opened the door for me in a trajectory that I can't even describe.
Yeah, and for me, I'll specifically focus on my career as it relates to my representation of this fine organization. And I'll tell you the biggest challenge for me was our first year coming on contract and pushing collaborative practice, which had unsuccessfully been pushed prior, and we had to explain, look, with us on, it's sort of resetting the clock. And we were getting some traction, but that was really not the year it was going to pass. And there was legislation advancing to the floor of the Senate that was very detrimental as it relates to these dispensing machines, and really that would phase out and autonomize, make automatic sort of a lot of pharmacy practices, and explaining to the client that, hey, we have to shoot our hostage. We have to really take our foot off the gas on our priority. It doesn't look like it's in the cards, and if we try to spend political capital in playing defense and offense, we're going to lose on both. And when you bring on a new client, you want to succeed quickly for them, right? Mm-hmm. You want to succeed quickly. And these folks took my counsel very well. We played defense. We killed that while it was on the Senate floor, which is unheard of. We recalibrated and passed our priority legislation next year. And that was hard for me to say, hey, you all have to abandon your sort of dream legislation that you brought me on retainer for, because we have to shift and play defense, which was not sort of our goal. But they were able to be, again, going back to their flexibility, and it all worked out well. But in Spanish, we say, me tiene un poquito pena. It gave me a little bit of reservation to say, hey, you guys got to abandon that. But they were very well received, and they understood sort of in the aggregate why it was needed.
All right, so to end it on a fun question,
Mm-hmm.
I always ask this question. We've been doing a podcast for over 2.5 years, and this is my favorite question of all time. If we were to go back to undergrad, or maybe even pharmacy school, law school, and we were to ask your best friend, who was Kathy and who was Joseph, what would they say?
I think they would say, Kathy likes to party. And I think that that's probably true back then, but not so true today.
I think mine's similar. So what my friends would always tell me is, you're the most professional and unprofessional person I met. You flip a switch. And ever since I was young, and I've been working on and off since I was 13, but then I also like to party. And then when you're a student and you're interning, you're working or you're clerking, you can have one foot in professionalism and go to the other side of Tallahassee and act the fool. As you get older, not only I'm tired of partying, but you can no longer have those two lives. Yeah. And I think that's my brother and my friends would tell me, you're the most professional and unprofessional person I've ever met.
Well, perfect. I want to leave the last words to you guys. If you have anything else to say to the listeners.
I'd like to take this moment to ask everyone who's listening to this to become a partner with us in political action committee giving. This is how we get things done in Tallahassee. And what I'm asking from every person is not something I'm not willing to do. I give $100 a month to the FSHP Political Action Committee. But what I'm asking you to do is to give $21 a month. Between $21 and $25 a month will bring you up to $250. And if every pharmacist did that, and if every technician and student gave $5 a month, we would be able to take on so many more issues and be successful. Joseph, what do you think about that?
I think that's absolutely correct. And myself included, we all have reservations on how expensive and transactional politics can become, and we can bemoan that, but it's not going to change. The fact of the matter is, we are a bellwether state. Elections pour in national money, and it's an astronomical amount of money to get elected to the legislature. And as I said in our presentation, you have folks that don't like to fundraise and are not transactional, but that's the nature of the beast. And I love what Kathy said. We're not asking you guys to do anything that we don't do ourselves. At my firm, I also contribute per paycheck. I write thousands of dollars a year in personal contributions, but that PAC contributions allows us to increase our visibility, support those that support us, and just continue to move this society and the practice of pharmacy forward. And it's imperative that everybody partake, even on a small scale. It's monumental. Strength in numbers.
Well, I want to thank both of you guys for taking the time to come sit down with us. We really appreciate it. And to everyone that's tuned in, thank you so much for tuning in. And until next time, my name is Nima.
My name is Aaron.
And thank you so much for joining us.
Thank you, guys.
Thank you.
Thank you.